Yes, come in.
Hello.
Hi.
Good afternoon.
Hello.
How are you today?
I'm doing okay.
Great. My name is Jana.
Okay,
I'm going to
great.
be your nurse today.
Okay.
What brought you in?
Well, I've just started nursing school and I have a feeling of anxiety and a little bit of nausea.
Okay.
So,
Maybe a little stomach upset.
yeah, actually I do, yes.
And before we get started, can you just tell me your full name?
Yes, my name is Kristen Regini.
Okay, and your date of birth?
My date of birth is 070687.
Great. And do you happen to have any allergies I should know of?
No allergies.
Okay, before we get started, I just want to kind of give you a rundown of how I'm going to do things. We're going to do your posterior side first, and then we're going to come to your anterior side. And for the respiratory system, I'm going to be inspecting your overall shape and size and color. I'm going to be palpating, which means I'm just going to be pushing around with my hands to see how things feel. And then I'm going to be percussing, which is just trying to find out if I hear any sounds underneath you. And lastly, I'm going to auscultate, which means I'm just going to use my stethoscope and take a listen at your lungs.
Perfect.
Do you have any questions?
No, I think that sounds great.
All right, let's get started. If you could just turn this way for me about 90 degrees so I can reach your back.
Okay, I can do that.
I'm going to start by just taking an overall look at your back and seeing how everything lines up and is symmetric, if you have any swelling and the rise and fall. Okay, and now I'm going to go ahead and palpate. So I'm going to go ahead and feel to see if you have anything noticeable. Okay, and if you could go ahead now and say 99 for me.
99.
Great.
99.
Okay.
99.
And one more time.
99.
Okay, feels good. Next, I'm going to go ahead and I'm going to ask you to take a deep breath. Perfect. And I'm going to check for a little bit of pain or tenderness here. How's that, okay?
Yes.
And one more time. Okay, great. Now I'm going to go ahead and percuss your posterior.
Okay.
Can you just roll your shoulders forward a little bit? And now I'm going to come your arm a minute. Great. Next, I'm going to take a listen to your lungs.
Okay.
If you could take a deep breath for me. Okay. 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 Great. Another one. Great. Okay, deep breath. And the last one, go ahead. Great, your lungs sound clear.
Oh, great.
I'm going to take a listen again, and if you could just say 99 for me.
99.
Great.
99.
And again.
99.
And now.
99.
Okay.
99. 99.
One more time.
99.
Okay.
99.
And one more time.
99.
Perfect. Kristen, now I'd like you to say the letter E.
E.
And again.
E.
Go ahead.
E.
Mm-hmm.
E.
Let's do it now.
E.
Again.
E.
Okay.
E.
And the last time for me.
E.
Okay. Kristen, lastly, I'm going to listen and I'd like you to whisper the number 99. Okay?
99.
One more.
99. 99. 99.
Okay.
99. 99. 99.
And the last time for me.
99.
All right, Kristen, if you could just turn back around now to the side.
Okay.
And now we're going to start on your front. And just breathe normally for me. Okay? I'm just going to Look for symmetry, and I'm going to see if you're using any accessory muscles. Okay. Doing great. Kristen, next I'm just going to lightly palpate your chest wall. I'm going to feel the apex of your lungs. Okay. And your second intercostal space. If you could just lightly displace your breast to the side.
Yes.
Great. Okay. And how about up for me? Great. Okay, next I'm going to ask you to do the same thing, but just say 99.
99.
Great. Again.
99.
Okay, and again to the side for me. Okay, great.
99.
And one more time up. All right.
99.
Perfect. Just like we did on the back where I percussed in certain spaces to hear a sound, I'm going to do the same thing on the front. I'm going to start up here at the apex of your lungs. I'm going to move your shirt over a little bit. Great, and now your second intercostal space off of your angle of Louis. And now I'm going to go ahead and ask you to displace one more time for me. Perfect. Great, and now I'm going to ask you to displace up a little bit. Perfect.
Perfect.
I'm going to now listen to your breath sounds. And I'm going to listen to the apex of your lungs. If you could take a deep breath. Great. One more. Okay, perfect. Now I'm going to be your second intercostal. Perfect. Okay, great. And if you could displace one more time for me.
All right.
Okay. And one more. Great, and one last section from the bottom. Okay. And a deep breath. Let me just move your shirt a little bit so that I don't have any interference. Okay? Perfect. Okay, if you could just say 99.
99.
And again.
99.
Go ahead.
99. 99.
Okay, and if you could just displace your breast to the side for me.
Yes.
Okay.
99.
Again.
99.
Okay, and up to, there you go. Okay.
99.
Okay.
99.
Next, I'm going to do the same thing, but I'd like you to say E.
E.
And again.
E.
Okay.
E.
And again.
E.
And you could displace for me.
Okay.
Okay.
E. E.
And now one more time from the bottom. Okay.
E. E.
Great. The last thing I'd like you to do one more time is I'd like you to say 99. Whisper though.
99.
Try one more time. Whisper.
99.
Okay, great.
99.
Okay.
99.
All right. If you could displace.
Yes.
Thank you.
99. 99.
Okay. Okay.
99.
So that concludes the respiratory system, and now we're going to move on to the GI. Okay, Kristen, now that you're lying down, we're going to go ahead and start the GI assessment. If you could go ahead and raise your knees for me. Great. And this is going to be just the same thing as we did on your respiratory, except the order is going to change a little bit. I'm going to inspect first, then I'm going to listen to you, and then I'm going to percuss and palpate.
Perfect. Sounds good.
Do you have any questions before we get started?
No.
Great. Okay, Kristen, before we get started again, do you need to use the restroom?
No, I already did.
Okay, great. Can you just lift your shirt up a little bit
Okay.
for me?
Yes.
Maybe to the line of your bra, okay. And pull your pants just down a little bit for me, great, okay. And I'm just looking for the overall tone, nice flat stomach. I notice you have a scar right here, and it's in your lower right quadrant. Did you
Yes.
happen to have your appendix removed?
I did, yes.
Oh, great, okay. And I'm going to start with all 4 of your quadrants for a full minute. Okay, next I'm going to listen to your arteries. And I'm going to displace real quick so I can get to your femorals. Next, I'm just going to go ahead and percuss all 4 quadrants. Okay, I'm going to percuss your liver now, and your bladder, and your stomach. Great. Okay, Kristen, now I'm just going to go ahead and palpate your abdomen. Tell me if you have any pain. Okay, now I'm going to feel for your liver. If you could take a deep breath for me. Okay, great. Any pain over your bladder?
No.
Okay. Now I'm just going to go ahead and feel for your inguinal nodes and your femoral pulse. Great. I'm going to go ahead and check for rebound tenderness. So let me know if you experience any pain when I'm pressing down or when my hand is removed. Okay, now I'm going to go ahead and feel for your kidneys. If you could take a deep breath. Okay. Take one more breath for me. Okay, great. And the last thing I'm going to do is I'm going to go ahead and measure your liver. I'm going to use my stethoscope. And I'm just going to lightly scratch. Okay, Kristen, can you put your legs flat down for me now? Okay. And try to raise your leg up against the pressure of my hand.
Okay.
Any pain?
No.
No, okay. Okay, Kristen, that concludes our assessment for today. Before you go, do you have any issues that I should know about when you're using the restroom?
No, not today.
Okay, so go ahead and sit back up for me.
Okay.
I thank you for coming in today. And do you have any other questions, lastly?
No, I'm good. Thank you.
Okay, it was great to meet you.
Thank you.
And good luck in school.
Yes, thanks.